AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher, a guest from Central District Health Department. Teresa Anderson has come by to bring us up to date. It's Public Health Week, so we have a few things to talk about, but there are some key things that you want to discuss today. First, welcome back.
Thank you, Brian. Thanks for having us so regularly. We love coming out here to talk. It is Public Health Week, and we're pretty excited. The main point I think I want to make today is that we have learned a lot over the last few years.
Oh, you think?
We've weathered the storm. We're coming out with a lot of additional information about what makes us healthy and what keeps us healthy. And one of the things that we know on this Public Health Week is that we've learned that where you live really makes a difference how you live. So we're looking at, do you have good housing? Do you have good transportation? Are you able to attend the school you want to and the church that you want to attend? Do you have an environment where you have friends and family that support you? Those are what we call the social determinants of health, or social drivers of health. And when we look at those in whole, this is what tells us how healthy people are. Now, obviously, we have to have statistics, things like that tell us who has heart disease and who has diabetes, those kinds of things. But we're past the age where we used to take someone's blood pressure and say, hey, you need to see the doctor, your blood pressure's high, without even considering that the individual with high blood pressure may have just lost his job, he may not have a health care provider, he may not even have a place to live or any food to eat. And so what we've learned over time is that you got to look at the bigger picture. You got to look at where people are in their lives and know that where they are and the circumstances they're living in greatly impact their ability to live their best life.
So in order to do that, you can't really be on top of the ivory tower. You have to understand all of the factors, but there also, I would imagine, has to be some partnerships that really help to figure all of this out and how can it be better.
And that's part B of what we want to talk about, because what we learned through COVID, and we were very fortunate to have developed some strong partnerships prior to the onset of the virus. But what we know during COVID is that we had some really strong partnerships and built some new partnerships with education, with the hospitals, certainly, with healthcare providers, with any number of people, especially those organizations in the community like United Way and Head Start, Hope Harbor, those entities, just to name a few. We want to work collaboratively with them. The other piece is we need to be out in the community. It doesn't do us any good to stay behind our desks at the health department. We need to be out working with people, understanding them, identifying their needs and how we can maybe assist them. Big part of that is learning the languages that we don't know and having people on staff who speak the various languages that are now pretty common in our community.
One of the things that I've noticed from our perspective, and whereas we get to share the message either from you or take it to you one way or the other, but the thing I've noticed is that there are those who have a greater understanding of all of the needs of healthcare personally. You know, whether it's vaccinations, whether it's sanitation, whether it's eating choices, things like that. But then there's also that aspect that they don't want any part of it, but yet they're still part of society. And yet you still have to somehow offer them a level of respect, but then they also have to have respect going back and the understanding that in that case, you just have to figure out a way to make it work.
Right. And what we have learned, too, because we've learned a lot, as I said, but we need to meet people where they are. They have reasons for their behaviors, and it's not that they're trying to be antagonistic or they're trying to be mean or anything like that. They have reasons for the behaviors that they have, for what they eat and where they go and if they exercise or not. And so what we want to do is figure out what those reasons are and have a discussion on why those reasons exist, and is there an opportunity to maybe change that thinking just a little bit with their permission.
With COVID being in the spotlight and now gradually dissipating, but yet it's not gone, and it's probably never going to go away. But it's been 4 years, So, I mean, those are things that if we would have said that back then, there would have been panic. People would just, well, this is just outrageous. But yet, it's real. I mean, common cold, flu, All of these things. There's those who think polio is gone. It keeps alive somehow, as hard as some groups have worked to try to eradicate it. There's so many things that are still out there, and we have a job to do to try to turn those back and make our collective lives better.
Right, and if we're just talking about health specifically, we know that the viruses that exist have a way of modifying themselves, changing their structure so that they remain alive and so that they remain a threat to us. The same is with bacteria, because we know that now a lot of the antibiotics that we've been using have caused the bacteria to become resistant. So we've got some bacteria-resistant illnesses that are really hard to treat. And so we want to stress the need to only use antibiotics when it's absolutely essential. And with viruses, it's just a matter of staying healthy and staying away from those viruses, staying home when you're sick. Don't spread them to everybody else.
Prevention is one of the big keys, and it's something that you can handle every day. It's Public Health Week. Therese Anderson from Central District Health Department with some tips if folks have questions.
Yes, please call us or drop in. We're at 1137 South Locust, 308-385-5175, or check out our website at cdhd.ne.gov.
Teresa, thanks.
Thank you.
Good morning from AM 1430 KRGI 105.5 FM.